So today we have a track athlete that came into the athletic training room. She's dealing with a glute max strain. She's a sprinter. She felt pain in a track meet over the weekend when she was coming out of the blocks, and she felt a pull in her glutes. We took a history, what happened, and then we asked her what her chief complaint was. Her chief complaint is she doesn't feel like she has any power when she's running, or when she's squatting. She can't get through a full squat range of motion without pain. Same thing with a lunge. So we decided to use shortwave diathermy. One of the reasons for this is with the glutes, it's a large muscle group and a thick muscle, so we want a deep heat. It's also a large area, so diathermy is going to provide a deep heat to a larger area than ultrasound will. So shortwave diathermy is going to be more efficient than ultrasound. The depth of penetration for shortwave diathermy is about 4 to 5 centimeters, which is deeper than all other modalities, other than the 1 megahertz frequency of ultrasound. But like we said, the larger area needed to be heated is going to be more conducive for diathermy compared to ultrasound. From here, we're going to go into the settings. So this is our little monitor for our diathermy unit. You have the on-off button. So we want to turn this button on, which is going to kind of warm up the machine. We're not going to turn the treatment on until we have everything set up on the patient, but turning this on warms the machine up. We're going to do 15 minutes. So you do 15 to 20. 15 to 30 is the ideal range, but 15 to 20 is generally what most people use. We're going to use the delta T function, which is our mode, which is the thermal mode. So it's going to provide heat and a mild warmth to the patient. Our pulse duration is going to be 400 microseconds. We want a high pulse duration to create that thermal effect that we're looking for. And then our pulse rate is going to be 800 pulses per second. Same thing, we want a high pulse rate to provide that thermal effect and to heat the tissues. So we're going to talk about the indications and contraindications of diathermy. Some indications for diathermy are going to be, or in this case, she's dealing with a muscle strain of her gluteus maximus. Some other indications might be a contusion or a sprain, bursitis, any other muscle or joint lesion, something along those lines. Diathermy is going to be a good modality to use. Some contraindications are going to be don't use it if the individual is pregnant. Don't use it over a malignant tumor. If they have a fever, don't use it around or over the genitals, or don't use it around or over the eyes. And also, if they have a pacemaker, don't use it around a pacemaker because it can affect the electrical activity of the pacemaker. So now that we've talked about the indications and contraindications, we're going to get our patient set up and ready to use the diathermy. We have the patient set up and ready for her diathermy treatment. We are going to make sure and talk to her about diathermy, make sure she knows what's going to happen, what she should feel. She should feel a mild warmth since we are using the thermal mode on the diathermy unit. If it gets something that's uncomfortable or painful, I'll tell her to let me know so I can turn it down. If she's still apprehensive, I will demonstrate on myself to show that she has nothing to be scared about. And then after this, I will start the treatment. So we are going to place a towel over the area. And like we've said, she has a glute max strain. Make sure that's over the entire area. Then we're going to place the drum of the diathermy unit over the area that we want heated. From here, since we had turned on our machine earlier, it is all warmed up and ready to use. We are going to go to this on and off switch on the treatment, press on, and then as this is going, we're going to continue to talk to the patient, make sure she is feeling what she's supposed to be feeling, and just keep communication with her to make sure that she is feeling good and the treatment is going well. An advantage of diathermy over other modalities, especially ultrasound, is you don't have to have somebody doing the ultrasound on the patient. So if you have a busy athletic training room, you can set somebody up on diathermy and then go treat other athletes. Some things that we want to keep in mind when performing a diathermy treatment on somebody are 3 laws and 1 principle. The first law is the inverse square law, which is essentially if you increase the distance from the treatment source to the treatment area by half. So if you go from 1 inch to 2 inches, you're decreasing the intensity by 75%. The second law is the cosine law. When performing a diathermy treatment, you want to make sure that the drum is completely perpendicular to the area that you want heated. This allows for the most absorption. The third law is the Grothus-Draper law, which is essentially just saying that the heat must be absorbed by the tissues to create a therapeutic effect. The principle that we want to keep in mind is the Arndt-Schultz principle, which is just saying there's an optimal amount of time and intensity for a treatment to have the most therapeutic effect. For this treatment, we have the pulse duration of 400 microseconds, the pulse rate of 800 pulses per second, and the treatment time of 15 minutes. After we're done with the treatment, we have a 15 to 30 minute window to start doing exercises. We will do some body weight squats, go down to about a half squat to work on her range of motion through the squat, and then do the same thing with lunges, kind of work her or progress her into getting into a full lunge.